welcome to what promises to be a fascinating session on the EU's role in a world that is better prepared. Today's discussion is hosted by the European Health Forum in partnership with the Wellcome Trust. I'm Ashley Furlong, a health reporter at Politico, and I'll be your moderator today. We will be leading you through a keynote interview with Wellcome Trust's Jeremy FARRAR and 2 panel discussions. The first panel will be focused on the EU's partnerships with low and middle income countries during the pandemic. The panel will delve into some of the reasons why COVAX has struggled to deliver, and we will also look at Africa's ambitions to be able to produce vaccines on the continent. And we'll discuss the role of the pharmaceutical industry in these efforts. The second panel will focus on the EU's own pandemic preparedness plans. Here we will talk about the Health Union and HERA, 2 topics that we've spoken a bit about earlier today at previous sessions. And we'll take a closer look at efforts to create a pandemic treaty, as well as examining the intellectual property rights waiver being discussed at the WTO. Some housekeeping before we begin. We want the session to be as interactive as possible, so please use the Q&A function to ask questions to the speakers. You can also chat to other attendees and the panelists themselves in the chat box. So that's questions in the Q&A box and comments in the chat, and please keep the discussion going. Throughout the session, I'll be bringing in our newsroom where we have Wellcome's Kath Gina, who will put your questions to our panelists. There will also be a couple of polls on Slido during the session, and a QR code will pop up that you'll be able to use to participate in the Slido polls. So just to kick us off, we'll be hearing from a man that you are all very familiar with, the director of the Wellcome Trust, Jeremy FARRAR. Welcome, Jeremy. It's great to have you here today to talk about where we are, where we need to go, and I suppose how do we actually get there. In the opening plenary earlier today, we heard about rising nationalism and countries ignoring this mantra that we've heard time and time again of no one is safe until everyone is safe. We're now also seeing pandemic preparedness plans begin to emerge from the EU and the US that are very much focused on beefing up their own internal defenses. And I wondered whether you were concerned that as we emerge from the pandemic, countries are looking inwards perhaps rather than outwards.
Actually, thanks very much indeed. I just had an absolute panic that my headphones didn't work, but I hope by the smile it looks as if you've been there before yourself, and they are working. So it's a great pleasure to join. And I just thank everybody behind the scenes that's made this possible, and the Gastein Health Forum. It's a great pleasure to join many colleagues and new friends and old friends on this panel. So I'd like to deal with the specific question you asked about COVID, but I'd also, given particularly the nature of the Gastein Health Forum, just broaden it out if you wouldn't mind. I would frame COVID pandemic really as one of the first great challenges of the 21st century. But I think it is typical of the sorts of challenges we're going to face in the 21st century, and therefore learning the lessons and adapting and evolving to this sort of new way of work, new world really, I think is critical if we're going to address the great challenges of our time. And what I mean by that is, if I look forward into the future and using the pandemic as the example of it, I think the great threats really that we're going to face, the threats, the risks, the vulnerabilities of societies are all going to be transnational. The ones that are really, truly going to disrupt societies, wherever our societies are all going to be transnational. And therefore, we're going to have transnational solutions. Secondly, that science, and I broadly define science and culture, and I mean by science, the broad range of all degrees of science, are to some degree the solution to those. But if we can't involve, engage, and win the trust, if you like, of the societies we operate in, that science and that culture will only have limited value. And critically, that we build that culture and science into our politics, both national and international. And then third, and the last comment for just pausing, is that I think that the COVID has really demonstrated and lifted the lid on inequalities that we knew existed within and between all societies. It hasn't affected everybody equally. It's affected everybody unequally. And I think the rollout of the vaccines now, and indeed the access to treatments and tests and PPE and oxygen and everything else, is a reflection of the fact that if we continue to live in such an unequal world, then I think we are going to face a very, very troubling 21st century. So I think the task of today really is to ask, how can we not go back to a nationalistic insular agenda? How can we make sure our science and our politics, our policy making is not brought into conflict between domestic challenges and international agendas? And I think we have to look at COVID and answer the solutions as soon as we can. A year is too long to wait, but we have to also frame it for the 21st century.
Sort of more concretely on things that need to be done most urgently, you know, what are those top sort of 2 or 3 things that you think, you know, where urgent change is needed? You know, perhaps I'm thinking of things such as manufacturing capacity. You know, that's been a major flaw that we've seen throughout the pandemic, or perhaps, you know, billions more euros into research for future vaccines. You know, what sort of the top things that you think need to happen right away?
Yeah, there's others on the call that will come back to this as well, I hope, and I hope some questions will come up in the chat. In the immediate, I think that and we focus very much on vaccines, but public health doesn't work with magic bullets. Vaccines are absolutely critical, but vaccines exist in association with others, and when you add together interventions in public health, you get a better response. So that does mean public health interventions, non-pharmacological interventions. It does mean having access to oxygen and personal protective equipment. It does mean having access to tests that are reliable and well-regulated and useful. And it does mean having access to vaccines. Now, there's been about 6.5 billion doses of vaccines distributed in the last 9 or so months, but the vast majority of them have gone to high-income countries. The vaccine apartheid, let's use a word that Dr. Tedros used some time ago, is a scar on humanity at the moment. And as we talk in some countries about booster doses, about offering vaccines to people at really very, very low risk, we have to ask that, well, we can provide the answer. That is not the right thing to do. It is much more important that we offer 2 vaccines, one vaccine of one company, Johnson & Johnson's, but 2 vaccines of people to the world, really before we start offering booster doses to low risk people in high income countries. And we need to make sure that it isn't just about the manufacturing, but it's about the distribution, it's about the logistics, it's about the supply chain issues. And I'm sure others will come back to that. But at the same time, and this, if I can borrow an American expression of we need to chew gum and eat at the same time, or walk at the same time, whatever the phrase is, Richard will remind me later. We need to be investing today in second generation vaccines for COVID. These vaccines are not the long-term solution, in my view. There are going to be better vaccines coming along, which are a pan-coronavirus. We need to be making sure that we're not exposed to another pandemic or epidemic, which could arise anytime soon. We need to make sure to break down the tensions, east-west, north-south, on the origins of this virus, so that we can get back to sharing of information and sharing of data. And critically, as the Global Fund have argued very strongly, we need to make sure that we provide oxygen, PPE, treatments and diagnostic tests around the world. So that is what we need to do yesterday. If we didn't do it yesterday, we need to do it today. And we cannot rest on the idea that by September 2022, the vaccines will be distributed globally. If we wait that 12 months, we will have new variants distributed around the world, which will turn us back to some point in 2020.
So do you think that we should immediately, you know, what should Europe do right now? Should they be, you know, upping their promises to share significantly more doses? Is that sort of one of the, you know, what are the immediate things that the EU, for example, and European countries could do to bring that 70% target forward, so that we're not at a state where a year from now, you know, we might be giving booster doses, second booster doses to Europeans, but we haven't even given, you know, a first dose to many people around the world.
Yeah, I think it is. I just note that there's been a lot of elections in Europe over the last 24, 48 hours, and good luck to everybody trying to form governments in those countries. And a call out for Carlos Moedas, who became mayor of Lisbon, I think, overnight as well, which is a great for Portugal and for Lisbon itself. I do think what you described is right for the European Union. The European Union and other countries as well. I don't want to criticize them for doing nothing. They have done a lot, it's true, but they can do more. And I think that does mean sharing of doses now. If you shared a dose today, you wouldn't be able to get that into the arm of somebody in another country for many, many, many weeks. So what I'd love to see is the countries of the world coming together and say, this is our supply chain over the next 3 months. This is our supply chain over the next 6 months. How can we go from where we are today to getting vaccines distributed globally in cold chains to healthcare workers and other professionals in all countries so that they can be delivered? There is no point telling a country that next Monday you're going to have a vaccine. You can't deliver it if with that sort of thing. And there's also no point delivering to countries vaccines that are going to expire next week. So I think the best that could happen is a realistic, honest commitment to a time frame for sharing so that all countries can start to plan for delivering them. And let's not set that as the ambition of September 2022. I think this should be achieved by March of 2022. And otherwise, I think we all risk new variants coming, which would take us back to some point in 2020.
Thanks, Jeremy. Just a reminder to everyone listening, please send in questions. This is your chance to ask Jeremy whatever you'd like about this topic. And I have another question for you about booster doses. Do you think that we will be needing booster doses every couple of months for the next few years? And I think I ask that because I'm wondering, what the implications of that would have on global supply.
Massive implications. Remind ourselves that a few months ago, we were talking about vaccinating 30% of people in countries with 2 doses. Many, many countries are now talking about vaccinating 90% of their population with 3 doses. And we do know from data from Israel, indeed from Europe, North America, that the vaccines are waning. The antibody levels are falling over 6 to 9 months, not every couple of months. We need to separate the science of antibodies waning in somebody's blood from the true protection. The true protection against you getting ill, going to hospital and dying remains actually extremely good after 2 doses. There are some people with immunosuppression, the very elderly, people more at risk and vulnerable, that a 3rd dose I think is going to be very important for. But my belief is I would much rather, as Tony Fauci said in the United States recently, the focus has to be on access to 2 doses now, and let's worry a little bit about the boosting doses later. The getting more people vaccinated with 2 doses is better than some people vaccinated with 3 and billions of people around the world with none. On the second question, this is where investment today in R&D and manufacturing, and Richard, I'm sure will come back to this later. These vaccines are not perfect. They are amazing, safe, highly effective, but they're not the long-term solution to this pandemic or indeed the beta coronaviruses generally. We do need 2nd and 3rd generation vaccines. We need them to be given with other vaccines that can be given, and we need them to provide mucosal and other immunity so we get longer lasting immunity and we stop transmission. Those are 2nd and 3rd generation vaccines that we have to invest scientifically in today.
Thanks, Jeremy. I'm going to go to Kath now. I think there's some questions in the Q&A for you.
Hi there. Yeah, we've got a key question coming through in the chat, and that's how can we reconcile regional and national efforts at preparedness with the need for a global response?
I go back to the issue I raised at the start about the challenge of the 21st century. I think one of our huge political challenges of our time is when we face global issues where your domestic decision-making may be in conflict with your international responsibilities. How do we get our political head around that? Where your decision-making in UK, America, Brazil, Argentina, Germany may make you make one decision but your actual international obligations, and actually the right thing to do is to do the opposite. We're in a phase when our domestic and our international decision-making politically may pull us in different directions. It's very clear to me, if we look at climate change, if we look at pandemics, that we need to marry these 2 things together, because nationalistic responses, not based in scientific rationale or logic or approaches, won't make the world a better place. And yet, unfortunately, in the last decade or so, we've seen a rise of more nationalistic approaches and a more populist agenda. And I think we've got to learn from that and challenge that as to whether that's actually going to provide the answers to the 21st challenges we face.
Thanks, Jeremy. That's actually, I think, a sentiment that we're going to be carried throughout the whole session, and indeed it was definitely a sentiment from the opening plenary. We'll be hearing a bit more from you later, but now we'll be moving to a panel discussion on how the EU should partner with low and middle income countries. We have a stellar lineup. We have AHMED OUMA, Deputy Director of the African Centers for Disease Control and Prevention. We have EZEKWESILI, Senior Economic Advisor at the Africa Economic Development Policy Initiative, and Martin SEYCHELL, Deputy Director General at the European Commission's Director General for International Partnerships. Thanks to you three for joining me today. Just to kick off, I actually wanted to sort of set the scene. I wanted to know from Ahmed what African countries had learned about the EU during the pandemic. And my question is, have the European Commission and individual member countries been good partners?
Thanks, Ashley. Very difficult question there. Off the top of my head, in the beginning, yes. Somewhere in the middle, I think we sort of have had a bit of a bumpy season, particularly now when we're talking about the vaccines. But let me go to the beginning that the European Union as an intergovernmental institution has worked with us here at Africa CDC and the Africa Union very well. And we have initiated quite a few technical level activities that have contributed in a big way to our COVID-19 response on the continent. Individual countries have also come through, and we've had very good partnerships with them. And I'm not going to give you a full list because I don't want to leave anyone out, but Germany, and when I'm talking about Europe, I'll throw in the UK as well, Austria, Spain, it's a list. I think about 12 or so countries that we are working with now from different aspects of our response. So in that way, where it comes to capacity building, where it comes to access to some of the diagnostics that we needed, particularly in the beginning, this has been good. When it came to vaccines, the picture changed, and really very dramatically. That although the EU and other European countries are supportive very much of COVAX, it's pretty much support on paper, in the sense that pledges have been made, but those pledges have not translated into vaccines into people's arms. And here at Africa CDC, our stand is very clear that when you pledge, you deliver. Because we've had a series of pledges, and in the mind of anyone walking the street, when they hear 2 billion pledged, they assume it's been delivered. But very, very little of all those pledges have actually been delivered. And in this way, it disorganizes a bit the way that we work, because other partners presume, even our member states, presume that that pledge has actually been delivered. So in that way, we've had a little bit of a difficult patch during this season of the vaccines. Overall, though, the opportunity for Africa and Europe to be able to work together is immense. It's huge. And we need to ensure that we take this opportunity of the pandemic, especially the phases that are coming now for vaccination and other public health measures and other health products that we need. We need to take that opportunity and run with it. Otherwise, if we blink over the next 2 months, then if you ask me that question again after 2 months, and the answer will be quite different. Thank you.
Thanks, Ahmed. Obi, Ahmed just was speaking about, the current state of not getting these pledges that European countries have promised, not actually getting those vaccines into the countries themselves. Looking back at the beginning, when COVAX was first sort of conceived, European countries didn't participate in the way that it was envisioned. They signed bilateral deals instead. I wondered what you thought, if you thought that this was possibly one of the reasons that COVAX hasn't lived up to its original ambitions.
Well, I think that the first thing is to acknowledge the fact that Europe was not Europe in the course of the pandemic. Europe essentially just reduced itself to individual countries acting in their own individual interests. So within Europe, there was already a problem of coordination. And so it was not surprising that what they did was to lean toward any of the countries with which they had stronger bilateral relationships. Now that people are probably saner, realizing that we can actually better collaborate and cooperate towards solving these global public bad I think it is time to be more reflective of the necessity to acknowledge that the pandemic has taught us that health is economy and economy is health. And number two, that for Europe, this idea of migration policy being the be-all and end-all of its relationship with Africa is very dysfunctional, and that it is important for Europe to work in a more considered way, considering that it is the nearest neighbor to Africa geopolitically and historically. It needs to now take a seat at the table in a way that enables very analytically anchored, even it can be self-interested, but it needs to be analytically anchored so that we can see more improvement in the rhetorics becoming substance. Right now, Europe is speaking, not acting enough.
Thanks, Obi. Martin, some hard assessments there. Also some, options and some possibility, lots of possibility for a stronger relationship with African countries in the future for the EU. Do you think that's a fair assessment that we've just had?
I think it's an honest assessment, and I'm very grateful to have this opportunity to listen carefully to what my African colleagues and friends have to say. Clearly, I mean, I think we all realize that much more needs to be done. Having said that, I just point out three things. I mean, I'm not here, of course, to make any excuses. I mean, we all understand that things didn't work out as we all hoped they would. But first of all, this was a very much an unprecedented situation. Certainly, in all the planning that had been going on for pandemics, no one ever anticipated a pandemic of this depth and this duration, more importantly. Secondly, we were dealing with, and still are dealing with, a substantial shortage of supply. It's not just vaccines, it's practically everything else from the very first days of the pandemic, when we had shortages of PPE, and even had to ration PPE at one point. We realized just how fragile the supply chains are and what optimization of those supply chains has led to. And the third point, which I think is not often fully understood, at least outside Europe, is that this was the first time in decades that Europe had a huge impact in terms of mortality and morbidity from an infectious disease. I mean, the European region has had already close to 1 million deaths from COVID. And this caused a lot of panic. This was not something we were used to. And initially, I think that, and still is, I think now that we have stabilized the situation, I think this is now less of an issue. But we all remember the dark days of spring 2020 with the pictures from Italy of military vehicles carrying corpses, to the crematoria. I mean, this was a shock for Europe. And it showed also how fragile our health systems actually were, even though they are very well resourced. So having said that, I think we've learned a lot, and we've learned also what didn't work, most importantly, because this is what we're here to talk about. I fully share the view that we need to seize the opportunity. There is now, I think, much more awareness that health is a central issue. It's not a standalone issue. We've seen how pivotal it is to the entire global economy. We've also seen that many of the assumptions we've made about supply chains, about trade, do not hold true when you have a crisis of this magnitude. For just to give one example, it's not just an issue of we need to produce more vaccines and medical countermeasures. We need to make sure that increased production is distributed around the world as a measure of resilience. I like to use the analogy, it's not enough to have enough fire extinguishers in the large building. You need to make sure that they are distributed across the building because you don't know where the next fire will break out. And this is in everyone's interest. And this is indeed what we need to focus on, but we need really to reverse some negative trends. I mean, we had been pointing out for many years that there was a disinvestment in vaccines going on. Companies were moving to other areas, and research into infectious diseases was not what it should be. And I hope we've all learned the lesson by now that we can't afford to underestimate. There are also some obvious weak links. I mean, we need to pay more attention to the global governance of all of this, preparedness. So how do we then support countries to really have also not only action plans that exist on paper, but are also sufficiently resourced and implemented? And the One Health approach, let's not forget, whatever the precise origins of this pandemic, it started in the interface between animal and human health. And that's almost certainly where the next pandemic will also start. And it could be even worse than this one. But not enough attention is being paid to that. So, and I'd like to echo finally the point made by my colleagues. Really, I think this is an opportunity also, especially for Europe and Africa, as two sister continents, really join together, not just by geography, but so many other considerations, to really find much better ways of working together. And maybe we'll have the chance later on to speak about some of the concrete initiatives that we believe are necessary to address the situation and have a real partnership between Europe and Africa to be much better prepared collectively for something like this in the future.
We will definitely be discussing some of those initiatives, such as the EU-Africa Summit next year. But I wanted to go back to something Ahmed said this morning about regionalism and multilateralism. Ahmed, you said that multilateralism had failed in your view. And I wondered, with regards to vaccine procurement, whether you think that a regional model is perhaps better suited to joint vaccine procurement in times of crises. I'm looking at the African Union's own efforts to procure vaccines, and they've been praised for stepping up where COVAX was struggling. So I wondered if you thought that that was a regional model should rather be favoured in the future.
No, thanks, Ashley. I'll repeat it that multilateralism has failed in this context. There's a lot of reason for that. Now, when we say it has failed, we don't mean that we should just get rid of it and put in a new model. That would be good, but we need to see how best to fix it. But when we are fixing it, it should not be at the expense of, in our context, it should not be at the expense of African lives and comfort. This is something that we'll work very hard to try and avoid. Where vaccines are concerned, particularly procurement of vaccines, our countries on the continent have weaknesses in as far as procurement is concerned, negotiating some of these extremely complex contracts, and we've caught a lot of those and ensure that our countries are not held to ransom by business folks who want to earn everything during this pandemic. So yes, as the Africa CDC and the Africa Union, when we come together, we negotiate better. When we come together, we ensure that equity actually also happens at the continental level. And that is our way of saying that this bilateral arrangement that you've been my friend, so take some 300,000 doses of vaccines is not a solution. It's a peddling influence. And I think this is extremely unfortunate during this time. Equity, when we talk about it at the global level, we must also talk about it at the continental level. And we believe strongly that when a coordinating a body like Africa CDC and the Africa Union is in the picture, then African countries benefit much more because then the equity is translated down to the continental level. Having said that, let me also add that the problem with the vaccines acquisition is not just access, but it is also the fact that when people look at Africa, they think we are waiting for donations. That's not it. We've been very clear that we want to buy our vaccines. Unfortunately, the 1.5 or thereabout billion doses that are called excess, it's a very bad term for us in Africa because it is not excess. Those are doses that are being hoarded. They are being hidden from those who need them globally. And it is, in my view, extremely inhuman for you to hoard doses and yet there are health workers on the continent that have not been vaccinated. When we talk about human rights, it's good to talk about, but when the rubber hits the road and it's time to act, then Europe, in this case, has failed us. There should be no vaccines being hoarded. Those vaccines, when they are manufactured, they should be in people's arms. And all these other debates we can have when we have had Africans, particularly those who are at risk, having been vaccinated. So in that context, access to vaccines has been artificially made difficult. It is not the natural way of a market operating. It has just been made artificially difficult. And I would urge Europe, all of it, not just the EU, to really see this in the long term, because there is always tomorrow. And those of us who have long memories, we will remember those who were with us and those who were not with us when the crisis was biting during this season. Thank you.
I think one of the longer term solutions is obviously increasing manufacturing capacity on the continent, and the EU is very supportive of that, in that it's promised €1 billion in funding from its budget and from the European Investment Bank for manufacturing of vaccines, treatments, diagnostics. So I wondered from Martin if you could outline, where this funding is going, and maybe what's been dispersed already, so we can sort of get a picture of what the EU is doing to help solve this problem.
Yes, Steve. I mean, I think a key lesson that this pandemic has shown is that indeed we need to produce not more vaccines and more pharmaceuticals in general, and we need to make sure that the distribution of that capacity is much better across the whole world. And clearly, Africa at the moment, unfortunately, is an outlier in this respect. Africa just produces 1% of all the vaccines it needs and less than 10% of all the medicines it needs. And this is something which is not good for Africa. It's not good for the world either, because it introduces a certain vulnerability in our global response. Now, our approach is, and we very much see this as a long-term partnership. We're in this for the long haul, is to really respond to the call made by African leaders who really have taken the lead to identify and address this problem. And there are three areas where we need, I think, to work together. First is to ensure that we can build an enabling environment for the pharmaceutical industry to invest strongly in Africa. This is, as my colleague was saying, this is not about donations, it's not about charity, it's about ensuring that Africa is a good environment, and this has benefits beyond just producing. We have a lot of important health conditions, major diseases and others that are simply at the moment not the focus of active research. We need much better treatments for diseases like malaria, tuberculosis, HIV, the whole host of forgotten, neglected diseases. And the best way to do that is to ensure there is an environment put in place in Africa. So we are strongly committed to support the strengthening of regulatory mechanisms in Africa, including the setting up of the new African Medicines Agency. We fully support that, of course, but also all the strengthening all the supply chain and production chain for vaccines, medicines in general, and very important is, as I said, developing Africa's research capacity. So the second point is addressing the supply health challenges. We clearly need to ensure that investment in Africa happens on a much larger scale. So we are looking at how we can, for example, de-risk investments by private companies in Africa, how we can support technology transfer. There are a number of initiatives which are ongoing at the moment to ensure that also movement of pharmaceuticals and essential components within Africa can benefit now from the potential of the new African Continental Free Trade Area. And we are working with a number of African countries already. I can mention Senegal, Rwanda, South Africa, where we've had very good discussions also with Ghana and other countries on how we can improve this. The third pillar would be to address the demand side challenges linked to what you just asked a moment ago. Africa is still, unfortunately, a very fragmented place, more than 50 countries, all with their own regulatory systems. And we know from our own experience in Europe that harmonizing that really has helped. I mean, Europe most European countries are small or medium-sized. And yet, because of our consolidation of procurement and demand side, we were able to put all our member states on the same footing. We very much believe that that is also something true for other regions in the world. That can be done, at least for crisis situations, that must be done. And therefore, we stand willing to work with Africa. This, of course, has to be African-led and African-owned initiative. But we believe that Europe, as the only existing regional model of regulation and procurement in the world, has, things experiences we can share, and of course, then they can be adapted and will be adapted to Africa's needs. But that is something we are very much eager to help with. Of course, this will require financial support, which is why the 1 billion initial investment, and to that we hope to add also investments by individual European member states, who we are confident will step up to the plate. The European Investment Bank is fully on board, but it's not just money. We also need technical and other support. We are working very closely in support of the initiatives led by the African CDC, like the African Vaccine Manufacturing Task Force, which we are very happy to support, and other important initiatives. And we very much hope to do this in a spirit of partnership. I think there's a great opportunity, I think, for all sides here. So for Africa, for Europe, and for the industry itself, to really change the way the whole model is constructed at the moment. But of course, it will require very important decisions on all sides. But we are confident that there is now the political momentum to sustain an initiative of this nature and this ambition.
Thanks, Martin. I'm going to go to Kath now in our newsroom to see if we have any audience questions for the panelists.
Got a couple that have come through. The first one is, what and how can Europe learn from other regions and countries as they think about becoming a better partner? And the second one picks up on a comment that Martin SEYCHELL made around disinvestment in vaccines ahead of the pandemic. How can we make sure, once the political spotlight on pandemic fades, that this does not happen again?
To give those a go. Obi, would you like to try and answer the first question?
I think that the key one that I'd like to make is that this is essentially a domestic issue to protect your citizens. So everyone understands that. We all must think of the fact that nationality, country governments have a responsibility. So it is the responsibility of the governments in Africa to make sure that Africans are protected. The thing, though, is, as Jeremy said in his opening, we now have to deal with global public bads. And these global public bads bring us together. And when these things bring us together, we need to anticipate the problems. The World Economic Forum, in its global risk assessment for 2019, the top 5 risks did not include anything around health or health pandemics. But we now know that, this is not just a new normal. There will be many normals that follow after this. And so I believe that conversations like this are meant to be honest conversations that help us to address the things that we still see gaps with. So the number one thing that I'd like to reemphasize is that while this is the responsibility of Africa, what Africa unfortunately has suffered is the consequence of bad behavior that has happened outside of Africa. We need to acknowledge that. When the pandemic started, I did put up an article in the Washington Post saying that Africa must be compensated for the fact that this poor management of a very local epidemic became global. And now it has taken Africa, wiped away all the growth that Africa achieved over several decades. And now it has to start all over again to build back. So when conversations around what it would cost to get public sector, private sector to the table, to negotiate the costs that are necessary to bear all of the productions that will help to safeguard health, we must not look at it as though anyone were donating to Africa. This is a global problem that Africa did not create. A poor management of an epidemic has created a devastation on the continent's economy. And so we must enter this conversation, not from a premise of we're donating to Africa. It's got to be that we have this transnational issue that has created an unfair a problem for the continent, weaker and more vulnerable than the rest. And therefore, it is the world's problem to actually support at the regional and national levels every effort at strengthening public health institutions as well as regional systems like the CDC. Then the second point that I'd like to stress is that the public-private partnerships are important. We must not compromise the necessity for the markets to work. I think that what AHMED is saying is that the same parts of the world that put a lot of emphasis on markets are not allowing markets to work. Market principles must be at the center of this conversation. And when the market principles give us pricing that is way too much, then we can begin to think of how to have the bucket of fund that will be co-shared between Africa and the rest of the world in order to create the subsidy to enable vaccines be available to Africans. And my third and final point on this round is that, look, if we want to admit the multilateral order is no longer serving us, we need a new 21st century multilateral order that would help us address issues of global pandemics, issues of climate change, issues of terrorism in a way that is upgraded to the current dynamics. And that therefore means a suggestion that the Europe needs to think of Africa, not just in this, Africa is our partner, but it's all word. Africa can be your partner with word. Africa has to be your partner from the perspective of a mutual interest, okay? Mutual interest must guide the relationship. And then the partnership has to be one that can bring the rest of the world. While the US and China are busy with their great power competition, do you know the continent that can step in with Africa and call the rest of the world to the table to design a new multilateral order? It is Europe. But Europe is failing to do that. And that failure is going to cost the world because you can do this. It's not China way, it's not American way, there is a global way. And that global way has to be underpinned by agreed values that drive us. Europe and Africa can be the two regions that will drive the world toward a new multilateral system that leads toward inclusive prosperity.
Thanks, Obi, for those very powerful words. We're nearly at the end of the first panel, but I wanted to take a chance to put up the Slido poll and to also so the audience could also answer that. And then if the panelists also would like to look and see what they would answer, how they would answer it. So the question is the EU's work on pandemic preparedness sufficiently connected to the discussions and work taking place in the global fora, such as the G7 or G20? I can't really ask Martin that because that would be sort of, I would expect him to say yes, but maybe Obi or Ahmed, I will go to Martin as well, but Obi or Ahmed, would you like to go first and say what you think? It seems like it's a resounding no from the audience.
I think no debate here, very well aligned. And maybe when we unpack why the answer is resoundingly no, I think we can be able to get better traction of what we need to do next. And most of it is out of what Martin has explained there. There was a lot of fear. And unfortunately, fear can take you either to the right place or the wrong place. What we need to do is manage that fear so that it takes us, all of us, to the right place. Otherwise, we'll end up in a ditch that might be difficult to come out of eventually. Thank you.
And Obi, would you like to comment on the results of the poll? What would you have how would you have answered that?
I'm actually surprised that 19% say they don't know. and that 13% say yes. I'm not being hard. I'm simply just reflecting the reality. We need to understand that political incentives are aligned now more toward a nationalism. And yet, we have to address a world that requires global solutions. So it is important that we even start with the education of the citizenry, of the electorate in Europe, so that politicians will be less likely to pander to these national issues in ways that compromise global possibilities and global solutions. So I would say that this kind of a poll is one that needs to be explained for what it is saying. It is saying that political leaders and bureaucrats are not carrying the people as well along in the way that problems need to be solved as we should say.
And Martin, how, in the next couple of months, the next year or so, how are we going to, move this so that we're getting a resounding yes?
Well, I think the key word in this question is sufficiently. And of course, I would be the first to admit that.
I like that. You're so brilliant. Sufficiently.
You're never sufficiently. I think it would be a biggest mistake to say, we're doing fine because our preparedness is always just as good as the previous, as the last pandemic. And we need to be prepared for the next one, which might be even worse and might be something even more difficult than this one. So I think what we need to do is urgently, and I fully agree with what my colleague said, there's an opportunity here and we need to seize it with both hands and make sure that we forge a real partnership. This is an issue of mutual interest. I want to emphasize that. I mean, this is something that we've realized that the chain is only as good as the weakest link in the whole system, and there are unfortunately a number of weak links. But of course, we have a basis to work on. I mean, Europe has, I think, although of course much more needs to be done. I mean, I can just point to the fact that the EU member states and our financial institutions have already disbursed 34 billion euros in support of partner countries during this pandemic. That's way more than the 20 billion which was originally pledged. And I'm speaking here about disbursement. Now, of course, is that enough? No. And we need to go beyond money. We need to go into all the other issues that define a partnership. Indeed, there's a lot that needs to be done and I think Europe is realizing that more and more, that our own security depends also on the security of the rest of the world, starting with our closest neighbors' security. And that's a key point. I think there's going to be also an opportunity in the next African Union, European Union summit. Hopefully that will take place early next year. I think that's a political moment we cannot afford to lose. We really, I think, need to make sure that we have already, by that time, hammered out a very concrete package of practical measures that can be submitted to the political leadership on both sides. And really, that's really what needs to be done before some other crisis overtakes us and takes away the attention from this important issue. So we're definitely working on that. I think what we've mentioned a moment ago about the manufacturing and support for strengthening the regulatory capacity in Africa, attracting investment to Africa, making sure that also African health issues are brought to the center of the research agenda. This is also important, and it needs to be also a key issue for discussion at the political level, not on the basis, as my colleagues were rightly emphasizing, of theoretical concepts. We need to hammer it down with concrete, very action-oriented proposals. This is what the 1 billion initial funding is aimed for. We are prepared also to do more if more needs to be done, and I'm sure it is. But obviously, we need to focus now on the nuts and bolts, on how to do this, because I think we all agree that we're not well served by the current system. And when I say we, it's all of us.
So I just wanted to say to you, Martin, that I totally agree with the enabling business environment improvement. That is so important. That's not just even for vaccines or for production of health resources. It is about everything. The continent must improve the doing business score, because if we're going to at all grow sustainably to achieve the SDGs, we must attract the investment from private sector. And it's our duty. It is our responsibility. The world is not going to improve our business environment for us. This is what our politicians, our policy people must do on the continent, and will be holding their feet to the fire on this. The second point is that Europe needs to recognize that while we're training our health professionals, and many of them are voting with their feet because the incentives are misaligned for them and coming to Europe. So Europe is draining us of the health practitioners that we need. Look at the number of epidemiologists that we would need on our continent, some 25,000. But how many do we have? 5,000. When you train one, they already are looking for that European country or the Americas that offer them better opportunities. These are all part of the conversations. I am not one for saying people should be held back, because really freedom means that people should go to where the opportunities lie. But if we're going to work as partners, these are all the kinds of issues that must be on the table on how we can better address without having migration policy by being the tail that wags the dog.
Fully agree.
Thank you, all the three of you, for a really lively and interesting panel discussion. We'll be coming back to Obi and Ahmed a bit later. Martin needs to head off, but we'll be moving to our next panel discussion now, and that is going to be on how the EU should better prepare for the next emergency. We have another great lineup. We have Ilona Kickbush, Founding Director and Chair of the Global Health Center at the Graduate Institute for International and Development Studies in Geneva. We have Richard HATCHETT, Chief Executive Officer at the Coalition for Epidemic Preparedness Innovations, or CEPI as we all know it. And we have Dorrit Nitzan, Regional Emergency Director at the WHO's Regional Office for Europe. Thank you all for joining us today. I think I wanted to sort of kick off talking about HERA, something that we've been speaking about earlier this morning if you were on the earlier sessions. And this is central to the EU's plans to ensure that it's better prepared, and it's part of the European Health Union plans. For those who don't know, HERA is this new entity that in essence makes permanent much of what the European Commission was doing during the pandemic, such as developing new treatments and buying these products jointly. From Ilona, I wanted to know, is HERA the game changer that was hoped for? And if it isn't, what would it need to have had or have for it to be that?
Well, good afternoon, everybody, and thank you, Ashley, for that question. I think we are all a little bit disappointed. There was a big discussion about strengthening the health competencies of the EU following the pandemic, or in the midst of the pandemic, as we still know. There were very strong voices. There were even countries who had long objected to the EU getting any further health competencies, like my own country, Germany, that spoke out clearly to say, for example, the responsibilities of the European Centers for Disease Control must be strengthened, must be widened. Of course, then there were the suggestions of strengthening the European Medical Agency, also in relation to pandemic issues, and creating this new authority, which was supposed to be initially an independent authority within the whole context of the European Union. Where we seem to stand now, and I hasten to add that the European Parliament is not in agreement, so we don't quite know where this will lead us to, is actually to have a construct within the Commission within the responsibilities for health. And it seems to be that countries have backtracked, and said, no, we do not want to hand as much in terms of health competencies to the Commission as we initially indicated. So we're at a bit of an impasse, I should say, right now. It's of course been, in quotes, launched. It has been presented. It's been presented as a solution, which I do not think it is at present. And we've been hearing similar things from the ECDC, that suggestions to strengthen its mandate and its responsibilities have also, are no longer as determined, let me use that word, as they were initially. And this is very, very worrying. because we have found one of the reasons, and none of the other speakers have actually alluded to it, one of the reasons that the Europe as European Union reacted in such a, disorganized way to the pandemic initially was that it did not have the competence, that it did not have the teeth, that it did not have the experience. And actually, in my view, it was quite extraordinary how quickly the Commission was able to move in that direction and actually get its very disparate member states, that were all rushing off to buy something, that were stopping trucks, that were putting up borders, that were not letting people move, to actually get them round the table and say, hey guys, and that was partly also linked to a rather strong German presidency of the European Union at that time, and shows what a difference a presidency can make. So I think we're not as far as the promises went to give us a European health union that is stronger within, and because it's stronger within, it can be exactly that strong partner to others to build things together. I'm, listening to the colleagues in the African CDC. I was speaking to colleagues of the European CDC just last week, and how they can learn from each other, how they can benefit from each other, how they could build that partnership that Obi referred to. And I think it is very, very disconcerting that member states are pulling back again and not making the European institutions for public health and pandemic preparedness as strong as they should be.
Thanks, Ilona. Richard, I'm interested from your perspective. HERA was meant to be the EU's answer to BARDA, and you obviously know BARDA well. You've worked there previously in a number of roles. This isn't, as Ilona said, this isn't even an agency. It isn't going to rival BARDA in that way. And I suppose the Commission says that the €6 billion budget is about the same as what BARDA has in non-pandemic times, but it's tiny compared to what the Biden administration is pitching for its own, sort of pandemic preparedness program of the future. Is the EU not being ambitious enough with HERA?
Well, I think in its original conception of setting up a freestanding authority that could move fast and that would be resourced at an appropriate scale, the original vision as it was first laid out sounded quite promising. I think the €6 billion budget is over 5 years or whatever period it's over, is actually quite limited relative to what is required for the future. I mean CEPI has estimated in laying out a scientific roadmap for how to enhance global epidemic and pandemic preparedness. I mean, we think that effort probably will cost in the range of $30 billion. The agenda is fairly straightforward and could be accomplished, particularly if the burdens were shared globally with the US, with institutions in Europe, with emerging institutions in Africa and other regions. Something that we could collectively as a world accomplish within 5 to 10 years. So a European down payment of $6 billion is actually rather meager given the scientific and financial resources of the continent. I would agree with that. I would like to see more ambition coming from Europe, more leadership coming from Europe. I was struck by OBIAGELI's comments in the previous session. The sources of multilateralism, the residual commitment to multilateralism is in fact strongest in Europe and in Africa, to my observation over the course of the pandemic. And Europe does need to step up and recognize that it is stronger in some aspects when it responds as a continent rather than the individual countries within it. There are things that are best managed at an individual country level. There are things that need to be aggregated at a continental scale. And unless the resources are provided to do that, that will not succeed.
And one of the key aims of HERA is to secure supply chains for the EU for future pandemics. Dorrit, I wondered, is there a danger that in Europe sort of securing its own supply chains, in essence, makes it's this island that can support itself and sustain itself during a pandemic, but then forgets about, other places that's not possible to do?
Yes, thank you very much, and hello to everyone. Indeed, I agree with all the previous speakers, and I think that we would also like to see a concerted effort by the multilateral vectors, so that everybody will join while we take care of maybe the EU takes care of the EU, and different nations or some groups of nations take care of themselves. We would like to see that part of their obligation, innate obligation, is to take care of the rest of the world, those that are in need for the same thing. So we would like to see a real good platform. And for me, and I'm really supporting what Richard just said, for me, it seems that the platforms that were established during the pandemic, I mean, we really tried with the partners to build new platforms. This could be a great success if we establish them, if we anchor them in different bodies, such as HERA. So I'm talking about the COVAX, for example, or the ACT Accelerator in general, or anything else that we can do as one platform. We also use the funding for strategic preparedness and response and planning, etc. So all these platforms are very good, and I do hope that in the special session of the World Health Assembly at the end of November, beginning of December, this will get the voice and the attention that are so needed, so that HERA and such will be really part of this global movement towards those in need in Africa and others.
And at that special session, that's when they're going to be discussing this pandemic treaty, and the EU's led a lot of that work. So, we might be seeing like it's sessions being quite hard on the EU, but the EU's definitely taken the leadership with leading the pandemic treaty discussions. Ilona, you've spoken about a pandemic treaty lots of times before, and I wondered what you thought this treaty should look like. Should the possibility of sanctions, as Germany has suggested, be included in the treaty? What kinds of things should we hope to have in an eventual treaty?
Thank you, Ashley. I'd like to start one stage earlier, though, and I think it's been very interesting geopolitically to see how the EU actually stepped in when Trump stepped out. And we've already forgotten that. I think, if the EU had not been as active as it had been in the spring of 2020, in supporting the World Health Organization, in supporting Act A, in helping build COVAX, a whole range of multinational, in quotes, mechanisms and institutions, we would be in very dire shape. And I think what is worrying right now, that in a sense, the US has come back on stage one way or the other, and suddenly the EU is turning silent. And I do think, and I come back to Obi's point, we are in a very difficult geopolitical situation. And I mention that because that is also happening around the discussions for a pandemic treaty. What the EU proposal around the pandemic treaty, which was put forward in November of last year by Charles Michel, and was actually also because Jeremy is here, in 2019, one of the proposals of the Global Preparedness Monitoring Board, that we need a global framework, as we called it. And that meant that it needs a multilateral anchor, that we need a global agreement that actually anchors and reinforces a whole range of issues. First of all, the political component, then legal responsibilities, institutional perspectives, because we would have a dedicated treaty body if we had a treaty. It's already been alluded to, a multilateral perspective. I think it was Jeremy who mentioned One Health. Those things are absolutely critical. And in terms of the subjects, as you have asked me, of course, there is the absolutely critical issue for Africa and other low and middle income countries of access and benefit sharing, of supporting, public health infrastructures and health systems, and, as you indicated, stronger mechanisms for compliance. Now, we were all surprised when the German minister suddenly spoke about sanctions. I can say that quite openly. But it is something that is, of course, something that's relatively rare in multilateral treaties. We've done a comparison of all kinds of treaties, from the more military, atomic energy, right into the environment. But there will be ways of having to establish stronger mechanisms of compliance. And the best way of sanctions, in very inverted commas, is actually to look at financing. And these are mechanisms that have also been discussed in relation to environmental treaties, that issues involving the financial institutions, be it the IMF, be it regulations of the World Trade Organization, etc., that then indicate if you do not comply, not for reasons of being poor. I mean, this is not, to punish poor countries, but if you do not comply, related to those kind of issues earlier on, then, there will be financial consequences for you. And I think those are things that will need to be negotiated. And we've identified, 8 areas that will be unique to a treaty that you cannot cover through the international health regulations. And also, let's not forget, the international health regulations are a different kind of instrument than a treaty would be, because a treaty legally needs to be ratified within a country and needs to be followed through with national legislation. And that is really an absolutely critical point about a treaty. Follow through national legislation. That is what we're trying to do in the environmental area right now. That's what we need to do in the pandemic area. And that's what we'll need to do around the digital transformation. Those big crises that Jeremy referred to, we need to have legal international agreements for global bads and global goods.
Thanks, Ilona. I'm going to go to Kath quickly to see if I think there's a couple of questions for the panelists.
Yeah, thanks, Ashley. Yeah, we've got a few that have come through. The first speaks to the comments Ilona was making at the start. If the EU and its member states are hesitant about extending power to ECDC, etc., how can we expect similar initiatives at WHO level to be received and be successful? The second question is around taking a holistic view of health equity. How can we combine partnerships with other regions in the world with working towards health equity in Europe? And the third one is on HERA. This might be one that Richard wants to take. Is HERA taking a sufficiently global approach? For instance, is it approach coordinated with CEPI? Thank you.
Should we start with the last one, Richard?
Sure. I mean, we were certainly consulted during some of the conceptualization of HERA, and we had ongoing conversations about HERA. Having come from BARDA, where I served in my last role as acting director before coming to CEPI, one of my comments to those who were conceptualizing HERA was, let me tell you about all the mistakes that we made so that you can make your own mistakes, don't repeat ours. So yes, we were consulted. I do think that it would be a mistake for any continent or any country to think that they can be entirely self-sufficient. I think that given the potential range of threats that we face in the future, it will be necessary to link together the initiatives like HERA, certainly like BARDA. I think CEPI as an international freestanding organization has a role to play in a network of national efforts and regional efforts, which all have important complementary roles to play. How HERA evolves, if it focuses inward and only focuses on securing national health security or Europe's regional health security, I think that would be a mistake. I think the world needs multiple like institutions globally distributed, and it needs those institutions to actually work together and attempt to coordinate their efforts. They all obviously have responsibility for the populations they serve, but the foundation of pandemic preparedness in the future has to be international collaboration. No national health security effort by itself will be able to withstand, a future pandemic threat.
Thanks, Richard. Dorrit or Ilona, would you like to try one of the other questions, maybe the one on, if the EU and member states are hesitant about granting greater powers to, ECDC, etc., how is that actually going to affect, these initiatives that it supposedly supports at the WHO level, like the pandemic treaty? Dorrit, are you?
Yes, thank you. I believe that the ECDC and the other bodies, every other European or regional bodies and entities, once we get together, I believe that we can work on the platforms and moving forward. So I'm more optimistic. I think that after all, we have all learned that Europe was not prepared. And we have to admit that Europe was really the epicenter. We heard it before. It was hit badly and it caused some kind of turbulence and echo. Now we have to gather all the energy and to find the way to look at maybe pan-European, but more than that, global platforms that will be sustainable. And I do believe that the EU as a strong entity will join us. I do hope so. I cannot see that it won't work. We are working very closely with the ECDC on day-to-day. Since the pandemic, we are actually together. And that's another good sign. So we learn together, we move together. We just need to find the real forces behind. And this, I'm sure that Ilona and those who know better how to deal with the health diplomacy can put us, into these turbulent waters, but I'm optimistic.
I like that optimism. We're going to put up a Slido poll now that links to much of what we've actually just been discussing. The question on the Slido poll is, can the EU pursue an agenda of strategic autonomy whilst helping prepare the world for future pandemics? And are these objectives compatible? As we start seeing some responses come in, if people want to respond to them, that's positive. Ilona, Dorrit, or Richard, how would you answer this question?
To see the strong yes here, because that's also what our African colleagues have been talking about. There is a legitimate national or regional interest, but it cannot be the kind of interest that makes you an island that puts up walls and says, don't let anything in, don't let anything out. So actually that would be the best of all politics, to say the way we approach a problem, and that's why we said a European health union can never be only for within Europe. It always has to be thought globally, that is this kind of give and take. And linking that to one of the questions from earlier on is, of course, that's the dynamic that develops when you negotiate, because you are not alone. You are sitting in a room with 194 WHO member states, And you are finding a way in which you want to cooperate and in which you want to ensure that your own population is safe and where you can contribute globally. And I think it is that kind of negotiation. And we must also see in terms, and that's what I said in my very first statement, if we're saying European Union, we're always talking three actors. And we do not take that into account enough. And they are not always on the same page. It depends who has the presidency and what the agenda of that country is. And it will be absolutely critical in spring of next year to have the presidency of France, a very strong, a very multilaterally oriented country. You have a European Parliament that is much more verbal, that is much more intense and very committed to a public health agenda and a global agenda. And you have a European Commission that has also expressed a willingness to go in that direction. And so I think, you know, balancing those three internal challenges with the dynamics that comes from the global agenda is a very critical one. And I do think the treaty negotiations can help significantly here to shift the discussions and to pull some countries who don't really see the necessity right now. But look, within Europe, a vaccination rate of 18% in Bulgaria, you know, I mean, where are we? So, you know, this has to be brought together, and I'm sure Dorrit has something to say about parts of Europe we have not spoken about, and the role of Russia, and then geopolitically China and the United States, and last not least India.
Thanks, Ilona. That was a really good roundup, but I'm going to give the other two speakers as well a chance to come in before we move to Jeremy. Dorrit or Richard, do you have any final thoughts?
Sure. Like Ilona, I was pleased to see the plurality, you know, saying that yes, those two things are not incompatible. I think the premise of the question is that there's a zero-sum game between taking care of one's national health security and contributing to multilateral efforts. And I think in a response mode, you know, there is a sense in which the response to a pandemic is rather like a prisoner's dilemma, where if you pursue your national interest or, you know, act individually, you will likely end up with a worse outcome than if you coordinate or collaborate. I think in a preparedness mode, however, as you think about preparedness, they are not a zero-sum game. And in fact, they are additive or multiplicative. And Europe focusing on, you know, strengthening its own national health security, both at the national and at the continental level, and thinking about how its health security fits into a mosaic of global efforts, you know, will contribute to strengthening global health security, which in turn reinforces Europe's national and continental efforts. So I would strongly concur. I think as we move out of the pandemic, we're moving into preparedness mode. We need to adapt the way we think and not think that we are necessarily going to, you know, be best off by preparing for the last war, as it were. But we need to have a number of different scenarios that we prepare for. Over.
Thanks, Richard. I saw Dorrit nodding to some of what you were saying.
Yes, no, I absolutely agree with both Richard and Ilona. And just to put it together, the European region with our 53 member states, as Ilona mentioned so correctly, and thank you so much for bringing that, we see really two worlds here. And we are troubled by this. The EU and the Russian federations and few other countries are really supporting each other. So we do see the support to neighbors, to good neighborhood, and this is happening already, and it's not one or the other. So I'm happy to see that the results of the polls are as such. But it brings me to, and I think again, Ilona mentioned Ireland, and it brought me to the thought that no man or a woman is an island, and no country or region are lonely planets. And that is something that we have to, I think, put in our compass when we move forward. We have to give the same as we give ourselves. We have to give to humanity. We have to shield all of us. And it's a front, it's one front. If we won't be one, we won't do well. So clearly, I'm sure that the EU, as well as others, are going to sit, and I do vote that the treaty will come to life.
Thanks, Dorit, and thanks, Ilona, Richard, and Dorit, for a really interesting panel. I'm going to be going back to Jeremy now. We've heard from some great speakers about, where we are currently and what went wrong during the pandemic with regards to vaccine equity, with some say the failure of multilateralism, and where we could possibly go with all of this, and how we could build a sort of stronger, better health system for the world. Jeremy, your initial sort of thoughts on what you've heard and what the speakers have said.
Well, some great comments. I mean, I think some really challenging comments. We've got to avoid sound bites. We've got to avoid trying to rewrite history and say it was all quite good. And I think we've got to avoid using the past tense for the pandemic. Abigail, I mean, we all do it. What went wrong in the past is still going wrong today. We have vaccine access of 1 or 2% in some countries. We heard even in member states within the European Union, or even in the eastern border of the European Union. And we're in the midst of it now. The pandemic's not going to go away. And if we don't solve the problems that have gone wrong, of which vaccine equity is only one of them, we need to look to the future. But the best way of looking to the future and having a cohesive way to work together in the future is to sort the problems out yesterday. If not yesterday, then best time is today. Just to pick up on a few thoughts. I mean, sadly, Martin's not with us, but we had enough warnings. Martin, I know many people will say, well, we just didn't expect it. I mean, we had enough warnings. Go back to, SARS-1 of 2003 and just go through every 2 or 3 years since then, and the number of warnings we've had, including in Europe, that something was going to happen. And my worry is, if there's some degree of rewriting of history, that the window of opportunity for changing, when this remains front and central of people's mind, will pass. And politics is all about events that overtake you. And you can already see it sometime moving on. I mean, in the UK at the moment, with the chaos of no fuel, or the trauma of Afghanistan, the world moves on very, very quickly. And there's a window of opportunity now to say, look, let's really address the current pandemic and put in place the future, I think. And if we don't grasp that now, I'm afraid if it waits until next year, then other events will take over and political interest will wane. Absolutely. I mean, Ilona is much more the expert on me on treaties, and the comment that a treaty comes with a national responsibility and a national government and political system having to approve it is a very, very powerful one. Otherwise, it's almost a memorandum of understanding. And those are, we all have loads of those, and they don't mean anything. I think that the comment about private sector PPPs, undoubtedly industry's got a critical role, but let's not let governments, and indeed philanthropy, but let's not let the public purse off the hook. Governments can do things that nobody else can. And it can't just say, let's have a nice public-private partnership and then put all of the onus on the private sector. It's got responsibilities, and I think it has to step up to them. I also take Ilona's point about the European Union. In May of last year, when other administrations were distracted with other things or had other interests, the European Union did some great things, pulling together, in fact, the first summit in May of 2020, which wasn't ambitious enough, I think, now in retrospect. But nevertheless, it did catalyze things, and President von der Leyen, I think, deserves great credit for having pulled together. The last thing I'm going to say is, and it builds into this sense of a shift in the center of gravity, which we heard from two colleagues on the call, AHMED and ABIAGELI. We've got to shift that, in manufacturing, yes, in regulation, and we have to have the ambition. I mean, European Commission, great, it's €1 billion, but that's a drip in the ocean to the real scale that is needed if we're going to shift that center of gravity. And the last thing I'm going to say is despite my own career in emerging infections, bring utility all of the time. Don't just think of rare events, because if you think of a rare event and it doesn't happen, after 2, 3, 4, 5 years, the interest wanes, good people drift away. Build this into horizontal, very strong health and scientific systems and politics, and bring utility all the time so that there's benefit today, tomorrow, next year, the year after. And then when something bad hits, A, you'll know about it sooner, and B, you'll have the systems and structures, whether that's universal health coverage, continuing support for R&D and manufacturing, but build it into the health systems that are providing utility all the time. Don't just plan for pandemics because you won't sustain it.
Thanks, Jeremy, for those really important takeaways. We're going to give the audience a chance to almost give their takeaway. There's a word cloud coming up where you can put one word, what should inform the EU's future approach to preparedness. So the audience will be able to give their takeaways, and then shortly after that, the speakers that are still online will be giving their brief takeaways. Let's see what equity. Efficiency and solidarity are coming up. Solidarity, yes. Lots of talk about solidarity at the beginning of the pandemic, though, and we're still saying solidarity now. So, would any of the panelists from either panel like to give what their one word would be?
Yes, togetherness.
Jeremy, do you have a single word?
No, I took 3 as a chair, a sort of prerogative. It's got to provide utility all the time.
Great. We're going to be going to the final sort of wrap up now. I'd like to ask sort of all the panelists that are online to give their takeaways in a sentence, if possible, about what is the EU's future role in global preparedness. I know no one likes sound bites, but if you could try and condense your thoughts, you know, how the EU, what role it should play in the future role in global preparedness. Should we start with Obi?
Hi.
Hi.
Say that again, please.
Yes, so what is the EU's future role in global preparedness? If you'd like a moment to think about it, I can go to Ahmed.
Yeah, go to Ahmed.
Yeah, Obi is ducking there, very smart.
No, you know, I
should
never
have done. So for me, Ashley, and this ties in also to the poll that was going on, is consistency. Europe needs to be consistent. And I say this because the EU has been engaging with us at the AU very effectively. The EU, and I think Ilona reminded us, stepped in very effectively as well when, let me not say the US, but Trump stepped out. And this provided very good stability. When we come to the WTO, the EU is somewhere else, and this is not consistent. So if we are going to do effective preparedness for future pandemics, we must be consistent. If we are not consistent, we cannot be able to deliver on good preparedness. And we as at Africa CDC, the Africa Union, we promise Europe that we will be consistent. Thank you.
Thanks, Ahmed.
So,
yes, Obi.
I think they should come out from the shadows. I just cannot imagine a Europe that continues to be a fiddle to either China or to America, depending on what time of the day it is. I think Europe should understand that when two opposing powers are thinking that all of us must go their way, we should be able to have our way. Our way is our universal values that we hold strong to, and the key one for 21st century is mutuality of interest. Capitalism has served us well. I believe in the power of the markets, but it is clear that the markets are broken. It is clear that they are stacked up against the weakest and the most vulnerable. It is important to redesign this multilateral order. Europe should be courageous and show leadership. And it can do this by understanding that it cannot succeed without Africa. And by the way, Europe should remember that just 40 years ago, nobody gave China a chance that it would be what it is today. Stop underwriting the possibilities of Africa, Europe.
Thanks, Obi. Dorrit, do you have a final thought?
Yes, I would like to see as mentioned, the multilateral order for global resilience against health security. So that means to put health where it should be, the global and the mutual agreements where they should be, but already doing it from the prevention, preparedness, response, and recovery, so that it will be a full plan that allows us to move together as humanity, as we are one. So that would be my message. Thank you.
Thanks, Dorrit. Ilona?
Well, first, I want to underline every single word that Obi said. You know, it's as if she had been in my head. I agree with her. I think, you know, the European Union has a unique opportunity to help shape one of the most important areas of the future, of the present, one of those three big crises that our world is facing. It has to address that with the values that it holds, and it has to show that it lives those values within the European Union and towards other countries and its partners. And I agree with Obi that creating that European-African alliance is an alliance of such extraordinary potential that we all have to work together to take it forward. And I hope that each and every one of us can also contribute to that.
Richard?
I guess I'll end with a note of hope and a note of caution, and at risk of irritating Jeremy, I'll express it in a soundbite. I think in its best and most cosmopolitan aspect, Europe can be a standard bearer for science, a champion for innovation, and a beacon for equity and solidarity. And these should be its aspiration. But to achieve that, it will need to beware the centrifugal forces that would prevent it from achieving these ambitions, and these will be very strong.
Thanks, Richard. Jeremy, would you like to give it a go as well?
No, I've got nothing to add to what's been said. I think it's a really great summary from everybody that's just summarized it. I think the key message to take away, A, is one of hope, but B is one of committing to make the changes that we've talked about and be held accountable. Too often over the last 18 months, frankly, we've heard nice sounding pledges, we've heard warm words, but actually when it's come to delivery, we haven't. Vaccines is a good example, but there have been many, many others. And I think we have to hold our political colleagues and friends to account for the promises that are made. And if that happens, then I think Richard's optimism and forgivable soundbite will be delivered.
Thanks, Jeremy. I think that's a perfect note to end on. I would like to say a big thank you to all the speakers for taking the time today to join us and give their really important insights, and to everyone listening at home or in their office. A big thanks as well to the European Health Forum Gastein and to the Wellcome Trust for hosting us. I hope you will join further sessions in the coming days. The one just after this is on rethinking the future of cancer care. Thank you and goodbye.